Hi, my name is May. I'm going to be your nurse for today. Can you tell me your name and date of birth?
Oscar, September 9, 1994.
Okay, and do you have any allergies to any medication?
No.
Perfect. Do you know where you are?
Hospital.
And do you know why you're here?
General checkup.
Okay, and can you tell me what month we're in?
October.
Can you tell me who the President of the United States is?
Donald Trump.
Okay, so your alert and oriented times 4. Your vital signs were done prior to this assessment and they're all within normal range. I'm just going to check your head, okay?
Okay.
Are you feeling okay today?
Yeah, I'm good.
Perfect. And are you feeling any pain?
No.
Okay, so your head looks good. Your hair is evenly distributed and there's no sign of any bruising or scars or lesions, okay? Your skin looks good, evenly distributed. You do have a couple acne scars, but no lesions. I'm gonna check your ears, okay? Okay. Alright, and your ears look good. There's no drainage, no redness, no edema noted. I'm gonna check your nose. Can you look up just a little bit for me? Thank you. Alright, no drainage noted. Your septum is midline and there's no dry mucus or blood. Can you open your mouth for me? Okay, perfect. Your uvula is midline, your oral mucosa is pink and moist, and your tonsil graining is 3. Now I'm going to look at your neck. Okay, so your trachea is midline, your thyroid is symmetric, and there's no enlargement noted. I'm going to palpate for your lymph nodes, okay? This is your preauricular. This is your postauricular. This is your occipital. This is your submandibular, and submental, and cervical. Okay, and there's no lymphs noted, no hard nodes noted. I'm gonna listen to your carotid arteries for any bruise, okay? Use the bell of my stethoscope. Okay. Alright, sounds good. No bruise noted. Now I'm gonna palpate for your carotid pulses, okay? I'm gonna palpate your carotid and your radial at the same time. Thank you. Okay, carotid artery and radial artery are even and bilateral and +2. Now I'm gonna ask you to look to the left. Alright, no jugular vein distension noted. I'm gonna ask you to close your eyes and tell me what you smell.
Coffee.
Perfect, so your cranial nerve 1 is intact. You already had your vision test with the Snellen chart, which indicates that your cranial nerve 2 is intact because you have 20/20 vision. Now I'm just gonna check your eyes, okay? Look at my nose. Okay? Perfect. So your eyes are equal round, your pupils are equal round and reactive to light. Can you stare at this? Follow it with your eyes. And they're accommodating. Now follow it again. Perfect. The 6 cardinal fields of gaze indicates that your cranial nerves 3, 4, and 6 are intact as well as Perla, okay? Now I'm going to ask you to, can you sit up straight?
Oh, sorry.
And then now I'm going to ask you to smile. Can you puff out your cheeks? Perfect. Can you raise your eyebrows? Can you close your eyes really tight? Perfect. And do you have any changes in hearing or smell?
No.
Perfect. Any changes in taste? Perfect. So your cranial nerves 5 and 7 are intact. Now close your eyes. Tell me if this is soft, so tell me if you feel this, okay?
Yes.
Do they feel the same on both sides?
Yes.
This is hard. Can you tell me if you feel it?
Yes.
Do they feel the same on both sides?
Yes.
Perfect. So your sensory and your motor cranial nerves 5 and 7 are working. Okay. Now I'm gonna test for your hearing and your balance and your proprioception. Okay. So I'm gonna whisper something. Close your eyes and tell me when you hear. Okay. What you hear.
A, B, C. 1, 2, 3.
Okay, perfect. So your hearing is good. Can you close your eyes and stand up for me? Hands at your side. Perfect. Your Romberg is negative. Your proprioception is fine. So your cranial nerve 8 is intact. I'm going to assess your gag reflex, okay? Can you open your mouth? Okay. Can you swallow for me? Can you stick out your tongue? Can you move the left to right? Up and down? Perfect. So your cranial nerves 9, 10, and 12 are working. Now I'm going to ask you to shrug. I'm going to put my hands here, okay? Shrug. Shrug one more time. Can you turn your head to the left? Turn your head to the right? Perfect. So your trapezius muscles are working, indicating that cranial nerve 11 is working. Can you stand up for me? Can you walk forward? Can you walk back? Okay. You can go ahead and sit down. Can you touch your right finger to your nose? Your left finger to your nose? Your heel to your shin? Your other heel to your shin? Perfect. Those are all within, as expected, within normal limits. Your chest, I'm gonna look at your chest and your arms. Okay, your chest and arms are warm. No edema noted. No bruising, scarring, or lesions noted. Your chest, your thoracic cage is symmetric. I'm gonna put my hands here. Can you breathe for me? Okay, and your respiratory expansion is symmetric. Okay, I'm gonna check for your radial pulses bilaterally. Alright, your radial pulses are +2 bilaterally. Now can you move your arms up and down and in circles? Okay, your range of motion is appropriate for your age. Now can you, I'm gonna check for your deep tendon reflexes, okay? Your muscle. This is for your bicep. Okay. This is for your tricep. This is your brachioradialis. Perfect. Okay. You put my hands in the antecubital space. Okay. And this is your tricep. And this is your brachioradialis. Okay. And can you show me your fingers? I'm just going to test your cap refill, okay?
Okay.
And these are less than 3, which is perfect. Now I'm going to listen to your heart sounds. Just breathe normally.
Okay.
Okay, I'm going to find the ankle oblique. Perfect. Okay. Now this is the second intercostal space at the right sternal border. And this is your aortic valve. So S2 is greater than S1. And then to the left of it is your pulmonic valve. And this is the second intercostal space at the left sternal border. And it's S2 is greater than S1. Third intercostal space, this is Erb's point, and this is the left sternal border. S1 is equal to S2. Now I'm going to go down to the tricuspid valve. This is the fourth intercostal space, and it's at the left sternal border. S1 is greater than S2. And this is the mitral valve. And this is the fifth intercostal space at the left midclavicular line, and S1 is greater than S2. Okay, no murmurs heard in your heart sounds. Now I'm just going to listen to your lung sounds, okay? Just breathe deep breaths for me, okay? Every time I move my stethoscope, go ahead. Perfect. Now turn to the interview. Breathe in and out. Okay. In and out. Deep breath. Deep breath. Okay. Okay. No respiratory effort noted. No adventitious lung sounds. Your lung sounds are clear bilaterally, anterior and posteriorly. Go ahead and sit front, straight with me. And now I'm going to ask you some questions about your abdomen, okay? When was your last bowel movement?
Today.
Perfect. And what color and what was the consistency?
Brown and soft.
Perfect. And when was the last time you urinated?
An hour ago.
And the color and consistency?
Yellow and
Oh, sorry, not consistency. Did you have any odor?
no.
Perfect. Have you had any UTIs recently?
No.
Perfect. Sounds good to me. Now I'm going to just look at your abdomen visually. No scarring, no ascites, no edema noted, also no scarring and bruising. Alright, do you have any pain in your belly?
No.
Okay, can you go ahead and lay down for me? I'm just going to listen to your abdomen sounds, okay? Okay. I'm going to start at the right lower quadrant. Okay. And this is the right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, you have normal active bowel sounds, which is good. Now I'm going to do a light percussion, okay? Let me know if you feel any, oh, sorry. I forgot to listen to your abdominal aorta, okay?
Okay.
Okay. No bruise noted in your abdominal aorta. Now I'm going to do the percussion, okay?
Okay.
Let me know if you feel anything. That's the right lower. This is the right upper. Left upper. Left lower. Perfect. Okay. No pain, right?
No.
Okay, everything is supinate. Now I'm going to do a like palpation.
Okay.
Let me know if you feel any pain. This is your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Perfect. And no pain?
No.
Perfect. Go ahead and sit up for me. So everything in your abdomen is normal and expected. Can you sit up for me?
Sorry.
I'm just going to inspect your legs, okay? So everything looks good. Your hair is evenly distributed. Your color is even. No scars or lesions. Okay. Everything is warm. Checking hidden edema. Edema is negative. Okay. Can I have you lay back down?
Yeah.
I'm just going to test your range of motion, okay? Can you move your right leg out, in, and then up to your chest? And your left leg out, in, and then up to your chest. Great. So everything is within normal limits as expected for your age. Now I'm going to check your pedal pulses. Your dorsal pedalis pedal pulse +2. Your tibial pulse +2. And then your cap refill is less than 3. Can you sit up? Thank you so much. And I'm just going to check your patellar reflexes, okay? And that concludes, that seems as expected. That concludes our physical assessment. Do you have any questions for me?
No, thank you.
Okay, thank you.